Hey friends, Ian Khan here at the Milken Global Conference, and I have somebody who can talk to us about aging, longevity, a very important piece of the healthcare puzzle overall. Lauren, welcome to the Futurist.
Thank you so much, Ian. I'm excited to be here with you talking about the future of aging.
Amazing. Tell us about yourself, your role at Milken, and what have you been working on?
Absolutely. So I'm at the Milken Institute, and I'm with the Future of Aging within MI Health. And at MI Future of Aging, we work on healthy longevity and financial security for all. So we look at those two things as two sides of the same coin. And my work specifically focuses on how do we age well at home and in community and enable older adults to live how and where they want as healthy as possible for as long as possible. And within that, I've been thinking a lot about how technology fits into that, and specifically how connected care around older adults in their homes, through wearables, on people around us, ambiently sensing, knowing about us, can give us insights to live better, longer at home.
Yeah, absolutely. And I can't, it resonates so well. I have folks in my extended family who are aged, who aren't that mobile anymore, who are struggling to walk even. And, you see older folks, maybe in some cases, get worse and worse, and you want to take care of them as much as you want to. So it's such an important thing that I think the whole population across the world kind of experiences. Technology can come to the rescue to some extent, of course. So what are some of the things that you're seeing are happening because of technology enablement, innovation? What's going on?
Absolutely. So we're having just an absolute explosion in new ways to know about ourselves, right? So we have wearables, we have home sensing that tells us about our movement patterns. We have, robots that help us communicate and connect, right? We have apps that, track different aspects of our health status, and all of these things are collecting data. And one of the things we're excited about is when we're able to bring these things together, what the possibilities are for not just having reaction to when there's a health problem, but to become more proactive about knowing patterns, learning about people, and helping people before there is a challenge or something that causes them to have a decrease in functionality or health. And so there's a lot of great possibilities. And you mentioned mobility, right? And so falls prevention is one area where the technology is really developing, right? So from the responsiveness to someone maybe having a fall because of mobility or environment, right? Being able to alert, get help, towards more proactive things about intervening before that happens. So sensing about how people are moving around their home, what their gait is like, medication management, and there's lots of technology for that, are all at play. And how do we look at that information together?
Yeah. Today, as of 2025, where are we with respect to these things being actually available, affordable, deployable? Like, where is all that right now?
Yeah, so the good news is we have a lot of components in the system, right? There's over 350,000 health apps you can choose from in one inventory. There's 18.8 million smart things, IoT things deployed globally. There's, so many different exciting age tech developments. And we have these great point solutions meeting people's needs. And one of the things that's exciting that is on the horizon is how do we get these things to work together? Because we know that's one of the challenges right now to helping your family members or older adults planning for their aging is these things don't yet work together as easily as we might want them to.
Yeah.
And so that's some of what we're looking at the Milken Institute Future of Aging is how do we help the ecosystem develop in a way that makes it easier for older adults, family caregivers, people involved in supporting them to age well at home, how to make finding what you need and deploying it easier. And then also, how do we build the evidence base and work on the way that we finance care to increase coverage for this so people can adopt these technologies, because right now that is a big barrier. Yeah. Because while we're seeing a rise in many types of tech-enabled care in the healthcare arena, it hasn't completely moved over to the home environment for care at home.
Of course, as we see, technology becoming very prevalent and available and accessible, wearables are something that have been out there for many years, starting from your tracker, your, running monitor, to different things where wearables can be. I personally see wearables not being everywhere. Like, I don't have socks right now that have wearables. My pants don't have wearables, but they're all kind of part of the product evolution that is potentially possible, and they can help. And talking about robotics, robots can help and assist people.
Yes.
And I feel, that there are many stakeholders that have to come together. There are the innovators who are creating and bringing these products to life. There's the funding and financing of those. Then there's the commercialization.
Yes.
You're probably working with stakeholders in the healthcare industry, from hospital systems. There are so many different stakeholders in place. What are you seeing from your research at Milken Institute on what are some of the barriers that we're facing right now towards going into the future? And what are those big barriers that everybody's facing collectively?
Yeah, absolutely. I mean, one of the big ones is that fragmentation, right? Separate solutions, separate and siloed data, right? Separate handling of healthcare and prevention, right? And well-being. And so those things aren't separate. And the more we can unite them, the closer we'll get to having that seamless experience that helps older adults, but also me, I'm excited for it personally. It sounds like you are too.
Yeah.
And so fragmentation, right? How do we bring it together? How do we bring the data together from provider-facing and consumer-facing technologies to get more insight from it, right? Because we do have a lot of data.
Yeah.
And that's important. And then as well, we do have to work on that piece about affordability. That is a big barrier to adoption.
Yeah.
And in addition to that affordability, because a lot of this is not covered under health insurance, it's about knowledge, awareness, access, right? There's not an easy place to turn centralized information that you can get tailored information about what your parent needs or what you need. It's really a DIY experience right now. You can select discrete solutions, but I'm excited about the possibility of bringing it together within a care ecosystem to connect all of the people in the puzzle. Older adults, physicians and care providers, community organizations, to get them in communication. To ultimately, the goal is to enable older adults to live independently, how and where they want, and engage with their loved ones in their lives and their communities.
Of course. So if there was a magic wand, and I'm asking this to everybody, if there was a magic wand and you could make something, happen in this field, what would that be that would yield immediate results for you, like within a short period of time? Is it funding that, hey, there's a lack of funding and we need X amount of dollars to come through to the system, and then everybody is going to be able to do what they need to do? Or is it awareness that there is funding, but there's lack of, what is this one thing?
To me, one really critical piece of this is a digital front door. Essentially, how do we make it so that people have a place to go where they can connect with devices or services or technologies that might help them, that puts their data together, that raises insights, right? We need ways. It's not just awareness about technology or digital literacy. We need ways for people to get connected with the incredibly personal experience of selecting the things that will work for their needs. If you're having, cognitive impairment and some level of access and functional needs and specific chronic diseases, how does that fit together for you? And how does that connect to your care team and how you want to live and where you want to live? And so we really need that. I'm going to call it connective tissue, portal, organization of solutions. That is critical. And I think with that and evidence, we'll get to more adoption, and obviously adoption is dependent on funding. However, this piece, the organization, is really critical right now.
Of course. Well, I can't thank you enough. Thank you so much for sharing these insights with us and our viewers. And hopefully, we're looking at a better tomorrow. We're watching the trends, and thanks for doing this incredible work.
Thank you so much. We're really excited for a better future of aging with connected care and smart aging. So
I really appreciate it. Thank
Thank you.
you. Thanks.